Hi. Thank you all for being here. We are counter-programmed a bit with somebody named President Bill Clinton, so people are going to be trickling in. I hope you understand. Welcome to Story Studio. And thank you to CGI for bringing this on, for talking about these important topics we're going to be spending the next 90 minutes discussing. Thank you also to the Overdose Response Network. I know some of you are here, and all of the hardworking staff for making this possible. My name is Elise Hugh. I am the host of TED Talks Daily, which is the flagship podcast from TED. I'm also a recovering foreign correspondent. I opened NPR's bureau in Northeast Asia, covering both Koreas and Japan. And from there, that inspired my book on the way that digital culture is now shaping our real-world beauty standards in a lot of ways, including the focus on thinness and smoothness and firmness and youth. I also suffered from disordered eating as a teenager, which actually took a long time for me to even admit to myself, much less talk about, which is exactly why I'm so gratified to be here today and for CGI for having this program. This is centered around visibility, which is so key for two global public health crises that really don't get enough attention, both substance abuse and addiction, as well as eating disorders. Substance abuse disorder and eating disorders are the #1 and #2 deadliest disorders, mental health disorders in America. And yet the lack of visibility around these issues really means so many people are suffering in silence, they feel like they're alone, and it contributes to shame, ultimately costing lives, livelihoods, relationships, and so many dreams. And I know you all know this. So today is about possibility. It's about solutions. It's about what's been tested and actionable in these areas. We have 6 speakers who, with very personal, dynamic, engaging stories that really put a focus on solutions and recovery. And I've gotten a chance to meet all of them, and y'all are in for a treat. Each of them will tell their stories, and then I will be back on stage following the first cohort to do a little Q&A, and then again after the second cohort. So we'll be able to be in conversation a little bit. In this first half, we have Jessica Geschke. She's the senior project manager of the Overdose Response Network from the Clinton Global Initiative, and Adeolu Adebiyi, who founded Youth Rise Nigeria. But today we're gonna kick off, luckily, a lucky guy who gets to go first, Sean Daniels, who is a theater director and the founder of Recovery Project, and he's the anti-stigma director for Live Tampa Bay. So let's give a warm welcome to Sean Daniels.
Hi, everybody. I'm Sean Daniels. Here's a really fun recovery story. So last night, I thought I would go to bed early because this seemed like an important talk to be ready for. And about an hour or two into it, my daughter, who is 6, and this is what 6-year-olds do sometimes, she just sat up in bed and threw up all in the bed. And, and she called for me and I went running. And there's a moment where you think like, God, this is not what I need this evening. And then I remember that there was a long time in my life that I was not a person that you could trust to turn to in the middle of the evening, much less one of the great joys of my life is having a 6-year-old daughter that has never seen me drink. And so to be able to take that into today was a really special moment. On October 12th, 2011, I was not in the same place. I tried to take my own life that day because it had been weeks since I had been sober. I was really only able to go about 30 minutes without drinking. And to be honest, it had been a long time since anybody had smiled to see me coming. And so instead of taking my own life, I don't know why I did this, but I called my mother, who I did not get along with at the time. And for whatever you believe in, it was my mother's 1-year anniversary of getting sober. She was walking home from getting her 1-year trip. I didn't know, I hadn't asked. And she got me through that evening, got me onto a plane the next morning. And if I make it to October 12th of this year, that will be 13 years since then. And since then, I have spent my time working with the arts to try to change national narratives. And national narratives do change. Let me give you an example. We have solved the scourge of peanuts in our lifetime. Okay? It used to be that if you had a peanut allergy, which is a real thing, you were just a little screwed and you had to figure out what to do or get an EpiPen. Now, if you say you have a peanut allergy, Delta will pull every peanut off of that plane. I go to conferences now where they are peanut-free conferences, right? In our lifetime, we have changed that. So why can't we do that for the same disease that kills 116,000 people each year, that is the #1 killer of people 18 to 49. If you are 18 to 49 in this room, you are statistically more likely to overdose than to die in a car accident or cancer or COVID or guns or any of those things, right? Why can't we do the same thing? We can't do it because deep down inside, we don't think that having a peanut allergy is a moral failing, right? So that's a narrative that needs to change. Here's another great narrative that we think about a lot. If you're as old as I am, you can remember this. Barack Obama, when he ran for president, was against gay marriage. Okay? Now, I'm from the beautiful but complicated state of Florida, and you can't say what he said today and run for city council as a Democrat, right? So there's been studies about how do we change national narratives in our lifetime. And maybe you won't be surprised, the answer is the arts, right? The TV that you watch, the books that you read, the movies that you see change what we perceive, right? Ellen comes out, everyone thinks it's going to be the end of her career. Magic Johnson gets HIV. Everyone thinks he's going to be, gone within a couple months, right? He's currently a billionaire in better shape than I am, right? Modern Family is on TV. Will and Grace is on TV. The Public Theater produces The Normal Heart, and the playwright stands out front and hands out information to everybody as they're leaving, and then eventually forces President Reagan to talk about the gay cancer that is happening, right? The arts change national narratives about what it could be, right? My mother, to this day, believes she has more gay friends than she had 20 years ago. That's not true, right? It's just actually that shame has been put aside and we're able to do that. So we need to be able to do the same thing for the arts. Let's think about what the national narratives are currently around the arts, okay? Well, let's think about what they are around addiction and how they're portrayed. If you ever see a person in recovery in a TV show, I promise you that they will relapse at the end of season 1, right? That is why they're there. We don't see people just in recovery, just living in the life. We don't understand that there's 40 million Americans who are living in recovery that are not portrayed just as they are in front of it. And so that's what we need to work on to change. Here's another narrative that we need to change. If you've ever watched on TV, if you want to get sober, this is what you do. You go to a strange church basement where like 3 people are sitting in a circle and then they chant your name at you, right? I cannot imagine why no one wants to do this, right? But in reality, that is nothing at all like what it is when you go into these meetings. But because we don't perceive it in that full way, that's what people think. And if you know anything about AA, I want you to think about this question. So, and regardless of what you think about AA, think about this. So when you go into a meeting, you go in and you talk to strangers and you tell them your story, okay? And because you tell them your story, a good portion of you don't die, right? So why is that, right? That's not brain chemistry. That's not science. That's not diet. That's not any of these other things. That's people sharing their story and not dying. And that's because we know today, right, that the opposite of addiction is not abstinence. It's community, right? And nothing does that better than the arts, right? That is the oldest form of storytelling that we have, going back to the Greeks. So what we want to do is we want to take that even further and figure out not only how do we change national narratives, but how do we center the arts in this conversation. So we are making a commitment today, the Recovery Project, the Clinton Foundation, everybody involved here, to put, they're right over here, these oak boxes, which you're going to learn more about, into every Broadway house. In the front, where the audiences come in, and in the back where the artists need them. There are more and more stories of workers in the performing arts who are passing away backstage and you don't hear about them. And then in the front, right, even if you don't use them, to be able to see that they're like a defibrillator, right, to be able to see that they're like a fire extinguisher. If you don't know this about defibrillators, it's a lot of fun. They're federally mandated to be in every building, and you have to test them every 6 months. Why? Because we don't think of having a heart attack as having a moral failing, right? But if you need it, it is there, right? And so for them to be able to see it, that's going to be a game changer for us. The last thing I want to end with, and I want to steal this, because it was a big part of the conversation about how we changed the conversation around gay marriage. Tony Kushner, in his play Angels in America, talked about how the real goal of everything that they were doing was no more silent deaths. And that is what I say to all of you today. That is our goal going forward in terms of anti-stigma, in terms of shame, that we can put the arts at the center of the conversation around addiction, and because of that, we can have no more silent deaths. Thank you all so much.
I have to top that. Thank you, Sean. I am so grateful to be here today. My name is Jessica Geschke, and I identify as a person in long-term recovery. What that means to me is I have not had any mood or mind-altering substances since March 4th of 2004. So I'm just celebrated 20 years, coming up on 21. Thank you. And so when I say grateful, it's because, as Sean mentioned, 116,000 people died last year due to their substance use. And that's one person every 5 minutes. Did I get that right? Yes. One person every 5 minutes dies in our country. So before we leave here today, think about that, right? Those numbers are so alarming. People often ask me, like, why did you get into this field? What makes you want to do what you do? And I've devoted my entire career into making sure that people with substance use disorders find the recovery that they need and can access naloxone. And so I can pinpoint the exact moment for me as to why I do what I do. It was a hot and sticky day in August of 2018. I found myself in a hospital room looking at my brother in a hospital bed. He was hooked up to tubes in his throat and his nose, and he had IVs in his arm. And in the corner of that room was my son. He was standing in the corner there with tears coming down his face, and he was asking God to please save his uncle. 22 years before that day, I was in that same hospital, in that same room, and I was there because my brother suffered his first overdose, non-fatal overdose. And I remember meeting my parents there that day. And for the first time in my life, I felt the immense feelings of guilt and shame. My brother and I, we were two peas in a pod, and I am supposed to be his protector. I was supposed to be the person that guided him into his teenage years, and somewhere, somehow, along those lines, he got lost. And I blamed myself for that. And as my brother weaved in and out of treatment centers and recovery homes and jail stints, I needed to do more, and I wanted to be more for him when he got out of those centers. And that happened in the summer of 2018. He became homeless, and I allowed him to move into my house with me and my kids. And in August of that summer, my brother overdosed in my home. This time, however, he overdosed alone, and he was found by my 12-year-old son on my living room floor. We had just gotten home from grocery shopping, and I was gathering the bags of groceries out of the back of the car, and my son went into the house first. And I'll never forget his high-pitched cries for help. And I knew without a shadow of a doubt, the moment I heard him scream, that I needed to find my Narcan. My brother was blue and unresponsive by the time I got to him in the living room. And my son stood there and he watched as I injected my brother with Narcan and performed CPR. I remember looking up at my son through my screams of yelling, "Wake up, wake up." And I saw these crocodile tears falling from his eyes. If you think about moments in your life that you wish you could take back or maybe hide from someone or just wish they never saw it, it was that moment. Life came full circle for me that day. I wish I could take back that PTSD and that trauma from my son. Life came full circle because earlier, when I was a teenager, growing up with my brother and witnessing all those things that he had gone through, I feel like I had internal wounds and they became scars as I went into adulthood. As I stood there watching my son, I knew that he was having wounds be created that would become scars for the rest of his life, and that I played a part in allowing that to happen. Several hours later, as we were standing in the hospital room, still with the tears falling down his cheeks, asking God to please save his uncle, I knew I needed to become part of the solution instead of the problem. And that is where my idea for the overdose aid kits was born. I made a choice to create something that would be a vehicle for naloxone to get out into the public with no shame and no stigma. So my goal was to get 25 to 30 boxes. I'm from Wisconsin. Go Pack. Get 25 to 30 boxes out into the public. I just wanted to get them out into the Madison area, which is our capital. And between 2018 and 2022, we deployed 350 boxes. And you can clap for that, because that was really cool. So I got 350 boxes out there, but I wanted to do more. I was just so hungry to do more. And I found myself standing in a city street in New York at this very conference in 2022. And I took my oak box and I walked up those escalators, went to registration, and I was here. And I presented these oak boxes in front of Chris Thrasher, and we did a Narcan training for over 100 people. And today, I am a senior project manager with the Clinton Foundation, and our goal is to get these boxes out into the public everywhere. And to date, we have over 3,000 boxes nationwide. So our overdose aid kits are filled with fentanyl testing strips, Narcan, breathing masks, and other harm reduction supplies. And we're giving them away, and we're also putting them into businesses all across the United States, coffee shops, police stations, high schools, you name it. We want an oak box. Everywhere you see an AED machine, there should be an oak box next to it. I became an advocate and the creator of the overdose aid kits because I wanted to save lives. I became an advocate for my son, that 12-year-old boy who found himself broken because his uncle, his hero, suffers from an unmanageable disease. I became an advocate for other people in recovery out there who sometimes feel like it's easier just to give up than to move forward. But I also became an advocate for myself, the sister of a person who suffers from the disease of addiction, but is so worthy of love and compassion and forgiveness, and who on August 8th of this past summer celebrated 6 years in long-term recovery because Narcan saved his life on that hot and sticky day in August of 2018. Thank you.
Thank you so much, Jessica, for that inspiring story. I'm going to begin with the story of Youth Rights Nigeria, and I'm going to say that it's an organization that started out of necessity. As many of us that actually understand about the HIV response globally, you recall that Nigeria happened to be one of the highest burden of HIV globally. But there was no national commitment until the early 2000s. And as someone, I started working in the HIV response in the early year 2005. And after working in the response and also monitoring the national response for over a decade, I realized that the specific part of the response driven by injecting drug use was not actually being responded to within the national response, especially among young people who inject drugs. I go out for outreaches and I see young people not only using drugs, but also injecting drugs. So for me, that became a challenge. I remember walking into a community at some point, and I saw several young people, not just young boys, but also young women with their kids in the community. I saw people doing drugs. I saw people sharing needles and syringes. I listened to some of their stories. I heard some of them say to me, we have lost so many of our peers to overdose. I heard some of them mention that, oh, we've had people dying from what we call unknown sickness. And a guy walked up to me in the community that very day. I call him Musa. That's not his real name. And he said to me, can you see the reality, pointing to the several young persons in the community who are actually doing drugs? And he said, the only response we know from the government is that of the police and the drug law enforcement officers coming after us. We are always ready for them. They chase us. Sometimes we are caught. We are locked up for days, months, and it could be years. And after that, we get released, and then we come back here. But I want to let you know the truth, that this is not how they can win. Looking at that experience that I saw that particular day, with also young women and their kids in that same location, growing up and doing drugs, it kind of influenced my resolve and other scenarios to say, look, this is actually a national emergency. There's an urgency for us to do something. Then I knew there's actually a need for a drug policy reform in Nigeria, and not just a drug policy reform, there's need for harm reduction services. But again, we need to begin by letting ourselves understand that drug use in Nigeria and in so many other societies is actually illegal. The focus of the policy oftentimes is on arrest and seizures. These are the indicators that the government and many stakeholders often use to measure our successes and response when it comes to drug use. I would say this is an unfortunate situation because just imagine your car is faulty and then the next thing you think about is to go to a fashion shop. Or you have someone who is sick and then you are directing the person to an auto mechanic. This is simply saying we have a public health challenge, but it's actually being led by the criminal justice system. It is an unfortunate situation, and I call it an aberration anywhere this happens globally in the world. So I knew I had a task ahead of me in terms of changing the law, in terms of policy advocacy, and also in terms of addressing the stigma that comes with drug use. You will all agree with me that even in our society, in our context, in the African setting, drug use is often seen as a moral failure. So for anyone who uses drug, it's not considered fit for the society. So I remembered I was interviewed on a national radio station as part of my national advocacy effort then, and the radio host asked me, and she said, can you please describe to the audience how a drug user looks? I knew what she was trying to get out of me. She was expecting me to talk about somebody with red eyes, somebody with tattered clothes, somebody with no future, somebody who is homeless, because these are the usual narratives in the media. So when she asked me that question, I said to her, a drug user looks like you. Then she was actually startled, like many of us were startled here. She was like, why? How do I look? I knew she was kind of concerned about maybe she's not beautiful enough or, but I said, a drug user looks like you, looks like every other person. And I said what I said, if we began to see drug users or people who use drug as humans, probably will be more moved to support their recovery. And when I talk about recovery, it's not just about the abstinence-based control, but ensuring that we are able to give power back to the people so that they are able to take charge of their lives. So back to my national agenda, I was worried about what the society perception is going to be when it comes to the public advocacy around drug policy reform and harm reduction agenda for people who use drug. I was less concerned about the pushback I'm going to get from the society because understandably, many of them are not public health experts. However, I was really shocked that the first pushback I had in my campaign was from the public health professionals. I had comments like, are you here to start promoting drug use? Are you trying to say it is now okay for people to use drug? Are you trying to let us, to say that we want to be giving needles and syringes to people? And such comments were like, oh, we want a drug-free society. These were the first pushback I had. So I knew that I had a challenge at hand. I went on to establish Youth Rights Nigeria, focusing on young people, and there was a need. Part of the strategy that we built upon was the fact that the national effort has to go beyond Youth Rights as an organization. So there was a need to build stakeholders. There was a need to reach out to other civil society organizations. There was a need to be able to build capacity for people to even understand what drug policy reform, harm reduction, and public health response to drug use is all about. Now, I would say 14 years down the line, well, Nigeria at the moment is not yet a drug-free society like any other society in the world. In fact, based on the last data, the drug use prevalence in the country is 3 times that of the global average. So drug-free society is utopia. We need to be able to come up with practical solutions. Youth Rights has been able to move beyond that, and at the moment has been able to reach over hundreds of thousands of young people with drug education, has been able to establish centers at the community level where services are being provided to young people, management of overdose cases, provision of harm reduction services, inclusion of young women. Because oftentimes when we talk about drug use, we don't remember young women. We don't remember that it's not just a male agenda. We also need safe spaces, and this is one thing that Youth Rights was able to establish and has been able to also provide antiretroviral treatment for those who are living with HIV within a safe space where they can also cater for their kids, because this is one part of the program of Youth Rights Nigeria that also, exciting, that some of the young women who have babies don't need to stay in an environment that is no longer ideal, but have a center where they can go and their kids can also grow in a safe space. So I would say today that the drug control space in Nigeria is not as punitive as it used to be. At the moment, there are so many voices. There are many collaborations ongoing between the Ministry of Health and the drug law enforcement agencies and also even the police, what we were not seeing before. But we are not yet there. Criminalization of drug use is still there. The law needs to change. And I would like to say that no country can actually get its way out of drug use with the use of gun, prisons, and punitive measures. And in closing, we need to understand that the way a society treats people who use drug or people with drug dependence mirror how we understand the principle of justice, equity, and accountability. Thank you very much.
Thank you all so much. We have our first 3 speakers here to join me on stage. Thank you so much for your engaging and rich and powerful personal stories. Sean, why don't I start with you? I'd love to hear if there are examples in pop culture of narratives that you feel have worked or have actually been accurate depictions or maybe helpful in the arts when it comes to addiction and recovery.
I don't.
Is there anything you like?
Yeah. I don't know that there's anything great right now, because I think, I was very lucky. I wrote a play called The White Chip, and we had like some wonderful producers came aboard, Hank Azaria and John Larroquette and Annalee Ashford and Jason Biggs.
Wow.
And I think they were excited because it was a positive take on how recovery can happen.
Yeah.
And I think I benefited from like sneaking in when there is not a lot of great stories about it. Recovery is about maintenance and about becoming a new person, and that's not necessarily dramatic. And so I think, when we talk about like other cultures, like we finally moved past a place where we feel like all LGBT stories need to be coming out stories. And we've moved past a place where all people of color stories need to be trauma stories. Right. But in the recovery space, we have not moved past the idea that stories aren't rock bottom stories. Like that is the only narrative we understand. And the only question is like, how did you get sober? Yeah. So I feel like we are at the cusp of really changing the narrative going forward if we can embrace recovery in all these different stories, and so that the average person can feel like that they understand how those stories work.
So a follow-up to you, but maybe Adiolu, you could also take this, which is what in your work do you feel like has been really effective in helping change the narrative?
I would say it's been more around community engagement.
Community engagement.
So having the people affected by the issue, by drug use, coming out to talk about their stories. One of the things we did at the early stage of our intervention was to organize the first national meeting of people who use drugs. Let people able to come and talk about their stories. Let people able to come out to talk about their issues and interface even with the law enforcement agencies to say, look, we are not criminals. This is who we are.
Yeah.
These are the support that we require. This is how we can work together to better shape the response. That has really been so powerful. Then the same public health professional that I spoke about that were initially reluctant to support began to change their perspective and began to see that we need to look beyond moral feeling, the kind of narratives that has really been everywhere before then. So community engagement has been so powerful.
Jessica, we are at a policy conference, of course. As you work on this issue, what do you feel that the policy community could do more of to support the millions of folks who are touched by addiction, beyond just, more funding, of course, and more attention?
That's a very deep question. So I'm from Wisconsin, and right now, one of the policy changes that we need are like testing strips, right? Xylazine testing strips. If I think back to last year, in order for me to even place fentanyl testing strips inside of our oak boxes, it was illegal. So it was illegal for me to have them on my person. So I was breaking the law 100 times. But xylazine testing strips are still currently illegal in the state of Wisconsin. Wow. And in order for us to move that along so that people can test their drugs, we have to go through the whole legislative process, and it takes forever for that to even move through and become a legal substance for people, or toolkit for people to have, for us to put into the boxes or anything, like just even have on our person. So I think it would be great if legislators or, we would have something that would go through and people could take a look and see, well, how are lives being saved, and then make those things legal for people to be able to hand out.
Yeah, as I was listening to Adiolu, I was hearing kind of some of the narratives that I recall from the 80s with the war on drugs and how you had criminal justice reform or criminal justice reformers, and that dynamic actually coming into play for a public health crisis. Do you feel like that, at least in America, has changed, that we've stopped criminalizing or thinking of addiction and substance abuse as something for law enforcement to handle?
I think we're starting to, I think, I've spent a lot of time in recovery spaces and nobody has ever said, Nancy Reagan said, just say no. And then I got sober that day. I have 7 years today. Like nobody ever does that. So I think we've kind of acknowledged that that didn't work. And so now, we spend a lot of time working with faith leaders and law enforcement to figure out, like, how when you encounter somebody, what are the steps that you have to take, right? Because honestly, an employer or law enforcement is probably who's going to encounter somebody first, right? So if we're going to really change the narrative, like, that's who needs to be equipped with all the tools, and then we need to collectively change, the story. My mother now carries Narcan in her car with her, not because I've worked in this space for so long, but because the neighbors now carry Narcan in their car, and she didn't want to be left behind. So, like, we have to change, like, that just shows that if we can start to change that, right, then suddenly, like, it becomes more common, and that's the goal.
Yeah, and we have a housekeeping message about Narcan too, right, Jessica? You wanted to mention?
Oh, yeah. So we have Narcan for every single person in this room, and we would love it if you take a box of Narcan with you when you leave. Actually, I'm not going to let you leave unless you take one. So, no, but please take a box of Narcan. And if you're not trained, I will train you. It takes 2 seconds. But yes, please take Narcan. That's another way.
I was saying that the swag here is a little different than other conferences.
Yeah.
Please don't leave without
Yes.
Narcan. With our last remaining few minutes, I'd love for each of you to talk a little bit about what you're hopeful about and what's working in your field. Why don't we start on this end and move in?
Thank you very much. It's interesting to say one of the not so good policies of the United States that was exported even to African setting was the war on drugs. And that has actually stayed for so long. So what we're witnessing even in many African countries in terms of response to drug use is as a result of the war on drugs. But the good thing now is that we're beginning to see more collaboration between the out response and also the law enforcement agency. The government, policy makers, stakeholders, civil society are beginning to understand the context the more and able to ensure more collaboration among these stakeholders to talk about this issue. Because for so many years, we were not talking about this particular issue because it's just like, just don't go there. But now it's being discussed openly, and there's more collaboration working together. In Nigeria now, there's the harm reduction implementation already, going on, even though there's need for legal framework and other policies. So I think this is something that shows a sign of hope, that shows that we are moving away from just arresting, locking up people, and it's something we are hopeful about.
Okay, great, Jessica.
In the recovery field, we have a saying that's called, if you're not at the table, you're what's for dinner. And I think because if we were having this conversation 10 years ago, we would be in a room with a bunch of policymakers and individuals that are not in recovery and don't even understand our space or what we're going through. And as of late, I'd say that we have a seat at that table. And they're inviting people in recovery to join them, people who look like me, to figure out the solutions to the problems. And that gives me so much hope because no one knows recovery better but people who are in recovery. So that's what I'm grateful for.
When we did my show, The White Chip, in January here in New York, after every performance, somebody would come up to the actors afterwards and say, like, okay, I'm ready to get help.
Wow.
And the actors, they were unprepared for that. They were like,
that
just
gave me
actors in a
chills.
show,
Yeah.
But somebody came up to at the very first preview and said, like, I'm not sober, but I'm an alcoholic. And then 2 weeks in, they wrote us to say, I have 14 days. Wow. And so I just think that type of work shows you, and like, theater is so strange, right? It's like 150 people at one night in one city. So it just shows, like, if that's the power that can happen with that, think about what it could be if we really were able to nationally change a narrative.
Scale it.
We could scale that up, right? Every single performance, somebody was ready afterwards to be able to take that leap.
Well, that's a lovely and hopeful note to end on. Thank you all so much for your talks and for speaking with us. Okay, and now we get to move into the next cohort of speakers that are going to focus on eating disorders and recovery. We have Dr. Ava Trujillo, we have Joanna Candell, and we're going to kick off with Lindsay L., who is a musician and a writer and a creative, and I'm so excited for you all to be able to enjoy this back half of the program. Let's give a warm welcome to Lindsay.
Thank you. These are not my notes on the screen, but who needs notes, right? Hi, everybody. Thank you so much for being here today. It might sound dramatic to say that a podcast saved my life, but it's the truth. In January 2023, I was still living in complete denial that I had an eating disorder, which means for 20 years, I was living with the understanding that the best way for me to handle my overly demanding life was my relationship with food. When I ate, how much I ate, or if I even ate at all. One night that January, I was sitting on my kitchen floor, bawling and uncontrollably eating anything I could find in my grasp. I quite literally couldn't stop myself from putting food into my mouth, and at that point, I knew I needed help. I knew I couldn't do it alone anymore, and for some reason, this thing that I thought gave me control was now the one thing that I felt I had no control over. In fact, I felt like it had control over me. Serendipitously, I was listening to a podcast a few days later of a woman I really trust who had just been diagnosed with an eating disorder. So many things she was saying resonated with me. And especially when she was like, it was so weird to me that you would eat 3 full regular meals a day. And I was like, that sounds so weird to me too. Looking back, I think it's easy to pinpoint where my eating disorder started. I was sexually assaulted when I was 13, and again, pretty violently when I was 21. So it made sense to me why control was something I became obsessed with when I was little. And at 13, that control looked like my relationship with food. It made me feel that in one of my scariest times of my life, that I actually had a grip on something. Now, I'm a recording artist, and I think we all know the entertainment industry is a breeding ground for eating disorders. You know, my friends and I were celebrated for losing weight and chastised for gaining it. And although I had a number that I constantly needed to stay under on the scale, I never thought I had an eating disorder. I remember walking into a boardroom full of men in suits who told me I needed to lose weight before I released my first single. Or I remember showing up to a photo shoot and trying on my wardrobe for the day, and it was a little tight. And a producer came up to me and said, "We don't have time to change anything, just don't eat or drink anything for the rest of the day," which would be 14 hours. Which at the time I was like, yeah, this is just my job. This is what we do. And now I know that's insane. I was also obsessed with diets growing up because they were a way for me to rationalize my restriction and make it actually be seen as healthy. So I was gluten-free and then dairy-free. I went to Weight Watchers with my mom when I was really little, and then Jenny Craig, and then I was a pescatarian, and then I was a vegan, and then keto, and then paleo, and then medical medium, and then bright line eating. I just loved all of them. And I didn't flip from one diet to the next. I did them all simultaneously. So then at the end of that list, the only category of food that I was allowed to eat was vegetables. I pretty much ate dry lettuce and vegetables every day. But then there were moments that my body would be starving, physically starving, although I didn't really know because your brain has this way of drowning out hunger cues. If you ignore them for long enough, you can't really tell when you're hungry or when you're full anymore. But my body would be physically starving, and any time my tongue would touch a bit of sugar, I would binge uncontrollably. I would eat a package of Oreos, and then a whole tub of ice cream, and then a whole package of anything I could find in my house. And this was not joyful eating, it was painful eating. I couldn't stop myself, and I wanted to stop, but I couldn't stop. And then after hours or sometimes days of binging, I would go work out for 4 or 5 hours to burn off a fraction of the calories I just consumed. And then I would restrict again for weeks. And this is a cycle I repeated for 20 years. Thankfully, I found some amazing doctors and an incredible ED therapist who walked me through my diagnosis of anorexia, subtype binge purge, orthorexia, and osteopenia. I know my eating disorder stemmed from unaddressed emotions. I think uncertainty is a difficult thing for any of us to sit with throughout life. But I really try every day to sit with my emotions now instead of blocking them out. Instead of pretending that I'm happy about something, I'm really trying to feel my feelings and express them. which can be really shitty at times, to be honest. It's not a fun thing to do, and if anything, it doesn't feel good sometimes, but it is so much better than numbing it out, because I know that that just makes the problem 10 times worse later. And it's crazy when you're numbing for so long. When I numbed out for so long, I was living a life I didn't even like. I was making decisions that I didn't even recognize because I wasn't myself. And the craziest part about numbing, I find with an eating disorder, is unlike substance abuse where you can avoid alcohol or drugs, food is quite something that we need. We literally need for our bodies to be nourished. And at the height of my eating disorder, I felt like food was toxic to me. So it was just so confusing. I didn't know how to regulate that. Every day now, I am learning and relearning how to love myself and love my body. I never thought I could be anorexic. I wasn't skin and bones, and I would compare myself to pictures of women that I found on the internet and said, I cannot be anorexic. I don't look like her. But my ED therapist reminded me that anorexia is a behavior, not a body type. I think one of the scariest things about eating disorders is that they can be so slow and silent, so you don't notice them, or you can live in denial of them for years. I would like to challenge every single human in this room to ask yourself, what is your relationship with food like? Is it energizing? Is it controlling in any way? What is your relationship with your body like? Do you like your body? Do you feel good in your body? Perhaps you know a family member or a friend who also has an interesting answer to either of those questions. I will proudly say that life does not have to be lived like that. It's such an honor to be here. I believe that our stories have so much power. And just like that podcast was for me, perhaps my story can be a voice for somebody in this room. I think one of the best things we can do in our lives is to be feverishly ourselves. But I feel like we only truly be ourselves when we can feel our emotions and use our emotions to navigate the decisions we make in life, which sometimes can be painful, but you can turn that pain into power. So wildly enough, I thank the diagnosis of my eating disorder for bringing me back to myself. Thank you.
Hi, everyone. So I'm a doctor, and people often ask me how I got into the field of eating disorders. And to understand my story, I need to tell you that when I was in medical school, I used to dream to work for the World Health Organization and to travel the world, study abroad, and save lives. But life had different plans for me. My husband crossed my path, so I had to rewrite my story. So 28 years ago, I was sitting in a dinner with one of the most prominent families in my hometown from Mexico. And we were not having this usual conversation you can have with a doctor. We were talking about their youngest daughter who was finishing a one-year treatment, home treatment for her eating disorder. And I was talking about all the people who had reached me out with similar cases during that year. So 1.5 years before that, this girl was 10 years old, and she was diagnosed with anorexia. The local doctors didn't know what to do with her. They said they didn't know how to approach it. So this family was directed to me by my mentor and some colleagues from the Boston hospital where I was trained in adolescent medicine. So they contacted me, and I went to meet this girl to the hospital. That day, she was going to be discharged by her pediatrician because he said she already had normal vitals, normal labs, and they put her on IV fluids. So when I checked her, she was severely malnourished. She had a cardiac arrhythmia. And I had the difficult task to talk to the family and make them trust me to put her in the intensive care unit and to treat her. So they trust me, thanks God, and she was in the intensive care unit for almost 3 weeks. And when she was stable, and this was difficult because she had normal labs, and everybody was saying, this doctor is just encouraging something she doesn't need. And when she was better, we took her out of the ICU, but there was no treatment facilities in Mexico. They were almost non-existent. So I suggested them to take her to the United States. And with that, she was brought to the Texas Children's Hospital. But unfortunately, there was minimal progress. And we start digging around the United States. We visit a lot of clinics looking for a clinic who could take her at 10 years old. And unfortunately, 28 years ago, they told us they would not take her. So finally, we found a clinic that could take her when she turned 11. So she has to stay 8 months in the Texas Children's Hospital until her birthday, so she could be admitted to the residential program. So finally, she did it. She went to the residential program, and 6 weeks into that program, we got a call, and they said she needs to return back to Mexico and recover with her family. So the life changed my plans again. Family contacted me again, and they said, what do we do? And I said, we do what we can with what we have. So let's take her back, and let's start treatment here. So I assembled a treatment team. I interview nurses, doctors, psychiatrists, psychologists, nutritionists. I tried to train them in a hurry to bring her back. And I set up a clinic in her house with a 24-hour care, with homeschool, with therapeutic activities and everything. And I basically closed my practice for a year to dedicate it to this project. And she slowly healed, and she recovered. And then we go back to this dinner we were having, and I was telling them that she was ready to go back to school. She was ready to go to life. So I was going to go to my practice, but what are we gonna do with the 38 people, with daughters, sisters, granddaughters from your friends that keep calling me to see that they may have something similar to your daughter? So the father of this girl told me, what do you wanna do? And I said, I want to save lives. Let's do something. Let's formalize this. And he said, what do you wanna do? And I said, let's open a clinic. And he said, no. We don't have experience opening hospitals. We don't run hospitals, so we cannot do that. And the mother said, oh, you know, I don't want any other family to endure the pain of the ignorance of professionals that we got a year and a half ago. So we need to do something. I said, okay, let's start with educating people, with the basics. Let's help them with that. So we decided we were going to start with that, and that day, Comenzar de Nuevo was born. That was 2 months into that, we decided to open the clinic because there was so much people looking for us, reaching out to us, that we needed to do something because it was not fair that we only educate people and we didn't do something else with them. So Comenzar de Nuevo means to start again, and that's what we wanted to transfer to the people, to inspire hope to families. And our logo is an adult hand lifting up a child's hand, because that was inspired by this girl. She said, we lifted her from the death. And so we started. August 9, 1999 is our birthday, and that's when we started. And from there, we had grown to be the most prestigious Latin American eating disorder society. And I have a passionate, committed team that had treated 9,000 patients and families in these 25 years. We had reached out with our educational and prevention programs to 250,000 people, and I had lectured in 37 countries around the world. We also have collaborations with academic institutions, NGOs, and other organizations around the world. We have 37 programs with them. And that is not all. We also had partnered with Meta and TikTok giants of social media to start our first Latin American helpline for eating disorders. And we do research, cutting-edge research. We have been partly funded by the National Institute of Mental Health from the United States, along with other universities, to do genetics in eating disorders. And we're running the program for Latin America and for Mexico. And this is very important for you to know, because eating disorders, the eating disorders and disordered eating, just as they were saying, are at the very core of all the mental health crises that we are embracing. Eating disorders and disordered eatings are more prevalent than breast cancer and than HIV. And unfortunately, they are not treated with the same importance that we should be doing. Eating disorders and disordered eating can kill people even if you don't have the weight, even if you don't have the criteria to say that you have an eating disorder. So that is why we need to do more awareness and we need to help people. And research in Latin America is scarce, but worldwide, research in eating disorders is underfunded. Just for you to have an idea, the federal report is that we give 73 cents per affected individual for the research in eating disorders, compared to $58 for autism per affected individual and $86 per affected individual for schizophrenia. So we need to do more. We need to do better. Our patients, our families, they really deserve it. They need this help, and they don't know how to get it, and they don't know how to do it. Just to have an idea, medical schools provide less than 5 hours of eating disorder training in their entire curriculum, and that is worldwide. That's why we're here today, because we need to make a change. So I encourage you to leave this room thinking, how can we do this? Thinking, how can we help all these people that is suffering? But because my job is gonna be done if you leave this place thinking that you know somebody who may have an eating disorder or disordered eating, because they are very, very prevalent and we don't know it. In closing, I want to remind you that Comenzar de Nuevo was born after one single case, one girl, who is now a vibrant, healthy, married mother of 2 beautiful children. She's the story of resilience, of community, of creativity, innovation, and of course, of not giving up. So please, leave this room thinking about that. And I want to close with a quote a very dear recovered patient told me after 15 years of anorexia. She said, "Not one more. Recovery is possible, and there is a life worth living after anorexia." Thank you.
Okay. Whew. My parents emigrated to the United States from France in effort to have a better life and to pursue the American dream. My father, a Holocaust survivor, and my mother, who grew up in extreme poverty, moved here to give me every opportunity that they never had. Never in a million years would they have thought their only child would struggle with food or eating, something that they never had access to when they were growing up. My eating disorder started when I was 11 years old. When I was 17, I ended up in the cardiac care unit, and my parents were told to say goodbye to me because they didn't think that my heart was going to make it through the night. Somehow, by some miracle, I survived. And what was really unbelievable was the entire time that I was in the hospital, no one said the word eating disorder. Now, mind you, I fit the archaic stereotype of who develops an eating disorder and what they look like. I'm white, I'm female identifying, Caucasian, I was thin-bodied, and on top of that, I was a ballet dancer. But I left there with just the prescription to my mom to go home and feed me some good French food. My eating disorder lasted 10 years, and over those 10 years, I struggled with anorexia nervosa, bulimia nervosa, and binge eating disorder. It wasn't until 5 years after that hospitalization that I finally reached out for help, and I tried to get care. However, my journey to recovery was not linear. Because my immigrant working class family didn't have the funding to pay for treatment, and insurance companies continuously denied care, I had to find treatment wherever I could. I was lucky enough to find a therapist that agreed to see me at a reduced lower rate, and I even found recovery in the rooms of AA. Now, mind you, alcohol was never my drug of choice, and the mechanism might have been different, but I craved being in a space where people spoke my language, because that's what eating disorders make you feel, like you are the only person in the world that is struggling with this. I couldn't have been further from the truth. What we know now is that 29 million Americans, that is 1 in 9 people in this country, will struggle with an eating disorder in their lifetime. They are biologically based brain illnesses and not disorders of choice. We know that early intervention recovery can help, and yet more than 70% of people that are struggling with an eating disorder will never get the care that they need for a disease that they never chose to have. I am so honored to tell you that I am 25 years recovered from my eating disorder. Thank you. And I know how lucky I am, but my struggle and the struggle of so many is never far from my mind, which is why I knew I had to pay it forward. I vowed to make treatment more accessible. I wanted to educate primary care providers so that they wouldn't let people that lied in hospital beds leave with a prescription to just eat better food. I wanted to create communities where people were seen and heard. And I wanted to change the way that mental health and eating disorders were talked about, or actually not even talked about. So during my last semester of college, I took out a student loan. I didn't use it for school, and I founded the National Alliance for Eating Disorders. I knew how lucky I am to be alive, and I knew I had to pay it forward. What started as a very small grassroots organization has 24 years later turned into the leading national nonprofit organization that offers education, referrals, and support for individuals experiencing eating disorders as well as their loved ones. What we have been able, thank you, what we have been able to accomplish honestly humbles me and takes my breath away. In 2016, we were able to help pass the first ever piece of legislation. Just this past August, we were able to help get eating disorders reclassified as serious mental illness. We've been tirelessly working since 2008 to make sure that eating disorders are treated on par with physical health as well as mental health. We have become the resource for every single social media network. We created the first ever summit for eating disorders at the United Nations. But more than anything, we've had the pleasure of being able to help people recover. And so the two primary programs of the Alliance is our free therapist-led helplines, which is literally where people pick up the phone that are skilled in treating eating disorders and help people know that they're not alone and give them resources to care. Our other is our free therapist-led support groups that are offered 14 times a week and are accessible and attended by individuals in all 50 states in 88 countries around the world. Last year, we welcomed over 20,000 attendees into our group. This year alone, in 2024, we have seen a 200% increase to our helpline, 200%, and a 22% increase in attendance to our support groups. What that means is we need to do more. We need to offer more. We need to help more people. So today, I am so incredibly honored to announce that we are going to make a Clinton Global Initiative commitment to action to meet the need and expand our services, because we need to make that happen. So what can we do? Because it's going to take all of us, just as the two other amazing humans that spoke before me and the three of you. It's going to take community. It's going to take partnerships. It's going to take all of us. We need to fight back against the shame and stigma. We know that community and connection is the antidote to shame and stigma. I am so incredibly grateful to CGI for bringing the eating disorder conversation to the world stage. My grandmother, who lived to be 100 years old, used to say to me, "Joanna, quand tu veux, tu peux." When you want, you can. This is going to be bigger than all of us. We have come so far, but we need to continue to the work that so many people in this room and out of the room have done. So please, will you join us? Let's continue the conversation. Let's make eating disorders awareness possible, because not one more person should be living with this insidious disease or have to suffer alone. Thank you all so, so much. I appreciate it.
Thank you so much to Joanna and Ava and Lindsay. How are y'all doing? With our final time, I'd love to just dive a little deeper into y'all's remarks. And one thing that all of you had me thinking was that we actually have seen a lot of improvements in terms of diversity in the media. There's a lot less fat phobia in films and television than there was in my youth. It seems as though there's more open conversation about eating disorders now. And yet, this feels like such an intractable problem. We are still seeing the numbers of sufferers of eating disorders run rampant. Why is this such a thorny problem? Do we want to start, I guess, why don't we start with Joanna and then kind of move?
Yeah. So I think it's a combination of so many people that have been suffering in silence and so much of the conversation happening, and yet so many other environmental happenings that I think come together to make that perfect storm, right? Yes, we are definitely seeing more conversations around mental health. Someone who's extremely close to me says, eating disorders are where mental health were 20 years ago in conversation. No one would talk about mental health. No one would talk about substance use 20 years ago. I feel like we are right there. So I think that opening the ability to be seen, to connect, we are seeing higher levels. But we also have to be very cognizant of the fact that we know that social media plays into it, the diet industry plays into it, fat phobia, weight stigma, all of that plays such a role in the conversation. And I have to say, the shame and stigma still really is such a perpetuator. Think about how many people are affected by eating disorders. Everyone knows someone that has an eating disorder, and think about how many people are not in this room. So that alone pretty much, I think, says so much.
I'd love to talk about the social media part. Dr. Trujillo, you said you work with Meta and TikTok. It seems as though there's so many messages that young people are getting these days that might favor eating, like restricted eating, for example, or dieting or orthorexia, and they don't even realize that it's a problem. So do you feel as though social media platforms could do more? And if so, what, when it comes to kind of regulating some of the content that young people are seeing?
Thank you for the question, because I am usually very often asked about this. How do you work with social media if they cause eating disorders?
Right.
They do not cause eating disorders. And Joanna and I have spoke about this in other sessions. And what we think is that if we don't bring them to the table, then what is going to change? Because now we're talking a lot more about mental health, but are we talking correctly? Are we doing the things correctly? Because talking more about it doesn't mean it's changing. So we need change. And to have the change, we need to have all the people on the table. Not only sufferers, not only professionals, but all the people on the table. And the only way they can change if we educate them. I want to tell you an experience we have specifically with Meta. They did a campaign. We work for Latin America. So they did a campaign for body image programs in Instagram. And we were in charge of advising them. And they put us a marketing agency from Brazil to do all the media, And after like 5 meetings, and to be honest, trying to kill them, we decided the only way we could help them to do the correct campaign was to educate them. So we gave them a program we call Body Project, which is a body image program. and to change their perspective about body image. So we trained them with that, and after that, they did again the campaign. And with that, we did a good campaign. And actually, in the debriefing, they told us that for Latin America, this was the campaign that has the most likes in the history of the body image campaigns they have had. So the only way to change is to put them on the table. That's why I accepted all these partnerships, because I think it's the only way we could move into the correct direction.
Lindsay, what are you seeing when it comes to Gen Z, Gen Alpha, and how they're facing this kind of soup of
I think it's
algorithms,
yeah.
and body image?
I think
and
it's
ideals?
honestly so hopeful. When we look to Gen Z and Gen Alpha, I think the topic of mental health is just so normalized. And when I meet younger fans, even at a show, all of them are just so open. They're like, oh, I have ADHD, and I have this, and I have this. And I was like, this is the most beautiful conversation that I can see from like young people in today's world. But I still think with eating disorders, I mean, at least for sure from my story, it's so easy to just either live in denial of it or just not notice it for so long. And I think also like the road of disordered eating, even before developing a full-fledged eating disorder, is kind of a slippery slope, and it's so easy to disguise it that you don't know until you're almost in too deep, and then you're like, whoa, why can I not eat anything? And so I think for sure normalizing the conversation so we can all sort of check ourselves, direct ourselves, check questions to be like, okay, is my relationship with food healthy?
One thing we haven't talked about is boys and men. What are you seeing among boys and men?
I'm so happy that you brought that up, because I think we live with this I like to call it the lifetime after school special mentality of who develops an eating disorder. But we know that eating disorders do not discriminate between age, gender, race, class, socioeconomic status, body shape and size, neurodiversity, ability. And to give you an idea, on our helpline, about 30 to 35% of all of our calls into our helpline are for individuals that are male identifying. But think about what our society knows eating disorders to be, that they affect predominantly women. And so something that's truly phenomenal, though, is because we are the resource for all of the social networks. When someone looks for eating disorder stuff or unhealthy content, our number comes up. Out of all of the phone calls that are originated on social media, the gender diversity is about 50-50. So just as many male-identifying individuals will call us than female-identifying. So it just proves to you when individuals are seeking information, they're going to be a lot less likely, because they've been told that, quote-unquote, men can't develop eating disorders, when it's the furthest from the truth. But when you're able to facilitate access to care or access to resources, it's going to be that opportunity for them to reach out.
There's also the persistent narrative that eating disorder sufferers tend to be rich white girls, right? And not happening in the global south or not happening in Asia. But you have seen, for example, what's happening in Latin America.
Yes, not only in Latin America. I was president of the Academy for Eating Disorders, which is the professional society for eating disorders, and we had members from 61 countries. And we have seen it in every continent, and just like Joanna said, every gender, every socioeconomical status, every body, every weight. It does not discriminate. And I want to add to what Joanna said, that we see exactly the same in the global south. The people who reach out to us is about 40 to 50% of our males.
And something that's really people don't realize is only 6% of individuals that struggle with eating disorders live in medically underweight bodies.
Yes.
Right? So think about how many people are struggling, and you would never know, because they don't, quote unquote, look like they have an eating disorder.
Yeah, Lindsay was describing this.
Yeah, and I think it's also something that happens when you're usually by yourself. So sometimes even your family or your partner would have no idea.
And also, every 52 minutes, somebody dies from a complication of an eating disorder. So while we are here,
Someone
two
passed
people
away.
had died because of an eating disorder.
Yeah.
So just having this conversation and this dialogue alone, I feel like has been really powerful in bringing visibility to something that is often unseen. Why don't we end on what's working in your fields that you want to see more of? Do you want to start, Lindsay?
Yeah. I mean, the entertainment industry is definitely a tricky one for this concept because it's just celebrated, honestly, if you're thin. And I remember being told when I first got into the industry that you'll be more successful if you're skinny.
Wow.
And it's a sad part to say that a part of that sentence is true. And it's so not true. And I think we are seeing so many people and so many role models that are proving that wrong. That it does not matter what your body looks like and where you've come from, your age, your race, your makeup to determine like how successful your career will be.
Great. What's working? And what do you want to see more of?
We're definitely advancing. We had advanced a lot in the past 2 decades, especially. And I think that something we say a lot in this field is that early intervention is crucial for prognosis. So I would like a lot to see more professionals, not in the field of eating disorders, but only professionals in the health side that will be educated about eating disorders, because those are the first front line for our patients. So I think if we could advance the dissemination of evidence-based information would be amazing.
And more research, of course.
More research, of course.
I think one of the things that are working is conversations like this. I just really have to thank CGI for bringing this conversation, because it's going to take your partnership and it's going to take all of us to be willing to have these conversations. As far as the Alliance, what's working is we have amazing research, amazing data on what happens when people come to our programs, the efficacy of when individuals pick up the helpline or they attend a support group. What do we see more of? More ability to do the work that we're doing. Because again, we know that there was a 104% increase in adolescents during the pandemic struggling with eating disorders that were entering the ER. What that says to us is that we need to scale up, we need to do more, because I do believe in recovery. Lindsay, like all of us here, like I do believe in recovery. And the last thing that I will just share is, if you or someone you know is struggling with an eating disorder, please know that there is help, that there is hope, that there is life beyond eating disorders, and it's messy and it is overwhelming. But never in a million years, from my mother's studio apartment where 14 people lived in extreme poverty, would she ever think that her daughter that almost died nearly 3 times from a disease that she never chose to have would be standing on a stage like this. So please do not give up and know that there is hope. Let us hold on to that hope for all of you.
Joanna, Ava, Lindsay, thank you all so much. And thank you all for being such an engaged audience. I know this is a little unusual, but please don't forget your Narcan on the way out the door. Thank you to CGI.
Head to our Impact Lounge for afternoon refreshments before our final round of breakout sessions, which starts at 3:15.